Assalamu alaikum wa rahmatullah wa barakatuh. Good day, everyone, and I hope that everybody is doing fine. My name is Dr. Nana Ahmed, and I'm one of the members of Pearls of the North. I decided to make this short audio in response to a recent post on Pearls of the North, which unfortunately generated some controversy. And I feel that as healthcare professionals, it is our responsibility to ensure that information that is sent across to people is actually correct, clear, and also lacking in ambiguity to avoid confusing people. So I'm not going to go into the details of the post, as the aim of this audio is just to clarify issues around the use of supplements in pregnancy. So as we may be aware, there are different guidelines out there, but these guidelines, depend on what part of the world you are in. So what applies in one part of the world does not necessarily apply in another part of the world. Likewise, even in the same setting, guidelines can be modified such that individuals are treated based on their needs. So it's not surprising or it's not uncommon to see two pregnant women who are at the same stage of pregnancy and seeing the same healthcare professional, but they are being treated differently because their needs differ. Even in the same person, it's not so uncommon to see that a pregnant woman is being given different treatment compared to her previous pregnancies, because each and every pregnancy is different. So in terms of the little advice I'm going to give, it is based on the World Health Organization guidelines specific for use of supplements in pregnancy. So the WHO recommends that every pregnant woman should be on folic acid as well as iron supplements right from before pregnancy, and this should be continued throughout pregnancy, from first, second up to third trimester. And I know that we also recommend that these supplements can be taken after pregnancy, during breastfeeding, as the mother needs this to build up her immunity, as well as enhance milk production. So even the WHO guidelines slightly differ, from one place to another, because people who live in areas that are endemic for anemia, meaning places where low blood count is highly rampant, and widespread. And unfortunately, Nigeria is one of such places where most people, most part of the population have got anemia. So in such places, the World Health Organization recommends even a higher amount of iron. That is double the amount that they recommend in other places to be used in areas where anemia is quite widespread. And this is because many pregnant women in such areas start off their pregnancies already anemic. And this is due to multiple factors, ranging from poor nutrition, to diseases that are common in such areas like malaria, worm infestations, or due to multiple pregnancies, or, not leaving enough space in between pregnancies. There are multiple factors, that contribute to low blood count in pregnant women, in such areas. So WHO recommends that people living in such areas, in addition to just taking folic acid and iron supplements throughout pregnancy, their own iron supplements should actually be of a higher dose. So I think I'm just going to mention a few other supplements which I have realized are not commonly mentioned, but they are quite important, to use in pregnancy. And in particular, I want to mention vitamin D. So a lot of pregnant women do not know that they need to be on vitamin D. I know a lot of people will say that, we have lots of sunshine in Nigeria. But the truth is, when do we get this sunshine? It's the early morning sunshine that is rich in vitamin D. Do we go out to get this early morning sunshine? And even if we do go out, we are mostly covered, for religious and cultural purposes, we are mostly covered. So we do not get to absorb the right amount of vitamin D. And this is needed for the growth, and development of the baby, as well as normal functioning of the mother. If you are taking, like a multi-pack vitamin, like the likes of Pregnacare, They usually contain, vitamin D, folic acid. They may not contain the right amount of iron. So you may not depend solely on such multivitamin packs for your iron supplementation. You may need to discuss with your doctor to have a look at how much iron, is in those multi-pack, multivitamin packs, and can recommend an extra amount of iron that you need to take. The same thing with the dose of folic acid in such, multivitamin packs. Some of them contain the normal 400 microgram folic acid, which is recommended by the World Health Organization to be taken on a daily basis. But there are so many people who actually need a higher amount of folic acid. For instance, people with diabetes, people with sickle cell, people with babies who have had previous neural tube defects and so on. There are a few people that fall onto such categories and need a higher amount of folic acid in the range of 5 milligram a day, which is, I think, the dose that is usually prescribed for pregnant women when they go for antenatal care. So if you are using the multivitamin pack, this may not necessarily contain the 5 milligram daily folic acid. So you need to have a look at it, and it is possible that you actually fall into the category that you need to be on a higher level of folic acid. Please speak to your doctor so that your doctor can give you the right amount of folic acid that you need. So if you were on regular medications, before pregnancy, for instance, some people are on tablets for high blood pressure, diabetes, epilepsy, other illnesses for which they were taking regular medication before they became pregnant. It is very important, just before pregnancy, when you're planning for pregnancy, you get these medications checked with your doctor, because some of them are actually contraindicated in pregnancy, so that they can advise you on whatever modifications, or changes that need to be made for you to have your treatments, done properly during pregnancy, as well as protecting the baby. There are also people, who take over-the-counter supplements. For example, there are people who take treatments for their skin. So in particular, I'm talking about things like, retinoid creams, vitamin A supplements that they take. So these supplements, they are contraindicated in pregnancy because they can cause lots of serious abnormalities in the baby. So if you are on such treatment, you need to stop them at least 3 months before getting pregnant. If you're not sure, get a doctor to check them for you. If they are not safe in pregnancy, they'll advise you to stop them at least 3 months before pregnancy. If unfortunately you become pregnant while on them, stop them immediately, and start your folic acid, iron supplements, vitamin D, and seek the advice of a doctor. I will also advise that if you have problems in pregnancy, whether it's related to the supplements or any other problems, don't try to treat yourself. Don't try to stop the supplements on your own, thinking that they're the ones causing you problem, because you might be doing more harm to yourself. Discuss this with your doctor, and they might be able to advise you on either things to do. They might change the brand of your medication. They might modify your doses. They might give you some practical advices to follow through, rather than just stopping them on your own and later on developing complications which could have just been avoided. There are situations where doctors themselves can decide that you don't need some of these supplements, for instance, iron, but leave this decision to the doctor. For instance, you may have a blood test done and your blood count is too high. This is not too common, but it is possible. There are some conditions that predispose to high, iron overload. I don't want to mention some of this so that people will not avoid taking supplements if they have these conditions, but there are certain conditions that can predispose to iron overload, and it is the decision of the doctor to modify the doses of your iron, either to reduce them or stop them. There are also, other instances when you are unwell and the doctor feels that you probably need a lower dose of iron. At that point in time, leave it to the doctor to do that, and they are likely going to increase you back to your normal doses of iron at a later time. So in conclusion, I don't want to talk too much. There's actually a lot to say, a lot of, there are lots of advice to give, but I just want to make it specific for supplements in pregnancy. So the World Health Organization recommends intake of folic acid, iron supplements, vitamin D, plus or minus other supplements, like vitamin C, iodine. Iodine, we usually have it in our salt and also fortified in other foods, so we don't need to outsource that. So, but in particular, folic acid, iron supplements, vitamin D, to be taken every day by pregnant women just before conception to first trimester, second trimester, third trimester, and even beyond pregnancy as needed. I hope this has been helpful in clarifying a few things. I do welcome comments, contributions, and if you do have any queries, which is within my knowledge, I'm happy to answer them. And I'm also happy to drop some links, for the guidelines. Thank you, and I wish everybody, good health, both in pregnancy